Well, I'm joined now by the Professor of Global Public Health at Edinburgh University, Devi Sridhar, who's also an advisor to the Scottish Government, and Richard Horton, editor of the medical journal The Lancet. Richard Horton, how did it feel watching today?
Well, I was actually incredibly grateful to Dominic Cummings because during those early months of the pandemic, I had people in touch with me on the front lines of healthcare, nurses and doctors fighting this pandemic, who were saying there was no PPE, there was no treatment, there was no plan, no preparedness at all. And the government consistently denied that, saying that there was a plan, that everything was under control and in order. And actually what Dominic Cummings today revealed was that indeed there was no preparedness at all. And I think that's important. It corroborates the evidence that was given to us through March, April and May of last year. It's very important to validate that experience.
Devi Sridhar, I mean, it also confirmed that the scientific advice the government was getting at the beginning of the pandemic was totally inappropriate.
Well, I think SAGE at the time operated like a black box, and they were seeing this as an uncontrollable infection, and so in a way presented the government an easy solution, which is basically do nothing. And there was a real lack of looking at other parts of the world, East Asia. You know, as editor of The Lancet, Richard published articles about what was happening in China. We had Taiwan. There were many parts of the world where there were lessons, but they were just completely overlooked in our response here.
So what are your big takeaways from today's evidence? What do you think we've learned?
Well, I think we've learned that first, we need humility in the face of an infectious disease. We finally saw honesty and acknowledgement from the government of the mistakes made. We now have recognition of that it was largely preventable, both the health and economic crisis, if we had managed to follow other parts of the world. And that actually this idea that we had to save the economy and sacrifice lives was just wrong. There was never a trade-off between health aims and economic aims. If you wanted to keep the economy open, you had to figure out how to suppress. And to do that, you required very early on to build up your testing system and your tracing system, support isolation. You had to have border measures in place so you didn't have a constant stream of infection in. And you needed to let people know about things like face coverings, you know, how the virus transmitted, so everyone in their daily lives could make those shifts. Other places avoided the kind of lockdowns we've seen over the past year, as well as the tens of thousands of lives lost, by following, you know, basic public health guidance, which took us a long time to get to.
Richard Horton, I mean, as he described, you know, this sort of struggle, the most powerful advisor not being listened, you know, he seemed to be saying, yes, lockdown early, follow what the Taiwanese and South Koreans are doing. All the things that people like Devi Sridhar and you were on Channel 4 News every night saying, and no one was listening. I mean, was that plausible in terms of the way government works?
Well, I think what you saw, and he talked about this, the multiple responsibilities that different parts of the system had, that nobody took single command and control responsibility. He talked about it would have been best if there was a dictator running this whole operation. Perhaps not a dictator, but what you had was you had multiple government committees, SAGE, SPI-M, SPI-B, NERV-TAG, the CMO's office, the CSA's office, all taking a role, but nobody taking that single responsibility. And that was the problem. All this data was coming in from China, from northern Italy, but nobody was able to channel that into a simple decision-making process at the heart of government. And you had a Prime Minister who thought this was a scare story and just swine flu anyway.
Devi Sridhar, some people might say, well, look, you know, you didn't have Cummings in Scotland, yet you've had a very similar epidemic there, very similar scale of problems, and you know the curves have followed the same shape. So maybe it wasn't that kind of chaos that caused what happened in England, and Scotland was no better.
Well, I would challenge that. I think at the start that Scotland followed a similar trajectory because there was only the source of advice was SAGE. It was a reserved power. It was not devolved. And very early on, after the lockdown, end of March, early April, First Minister Nicola Sturgeon set up her own advisory group with transparency, with minutes published, with membership published to advise her. And actually, if you look at that point, there was divergence in terms of our case numbers and in terms of our death numbers. But the problem is we are all one country, so we don't have control in Scotland over borders. So stopping, let's say, flights coming in, screening, and also financial power to actually be able to support different kinds of restrictions and interventions when they're needed. And so I would say, you know, obviously we've done the best we can in Scotland and there's a lot of mistakes that have been made, but actually we were actually having our hands tied as well along the way.
And do you think Cummings was better than perhaps you thought?
I found him actually quite honest because it followed a lot of what I think Richard and I were hearing from colleagues and from journalists about what happened. So it mapped and validated a lot of what we assumed had happened. I think he acknowledged his role in it as well, to a certain extent, that maybe he could have been more forceful. But I think, you know, he did acknowledge the mistakes that were made. And I think it's the first time we've heard it. And it's part of the process of healing and moving forward. We must move forward as a country. And if you look at the parts of the world that did well, they learned. West Africa learned from Ebola. South Korea bungled MERS, but they got it right this time. Taiwan was scared by SARS, so they got it right this time. And that's what our challenge is, which is to say, let's look back not with anger, let's look back with actually, you know, forensically, of what do we need to change in our system so it functions better next time? So we do not have multiple lockdowns, we do not have an overburdened NHS, and we actually come out of this effectively with not, you know, a lot of people dying who don't need to.
Devi Sridhar and Richard Horton, thank you both very much indeed.
Thank you.